back to them.
All right. Just a couple minutes past noon, so we'll get started here. If that's okay. I had a few things that I did want to talk about, and then kind of like last time, just wanted to open it up for any questions and answers. Just kind of have an open dialogue. I thought that went pretty well last time. The first thing that I think we're getting the most questions about that I should probably bring up and address first is Janesville and where we are with the new Janesville clinic. So we do have the agreement in place. We are moving forward. Right now we are working on the purchase of the land and kind of just jumping through some hoops to make that happen. It's not in question. It's just we're having to go through that process. And then once we do, we'll start to see things kind of rapidly take place. Waiting on a weekly update from Locker. Tried to connect with them today, so hopefully we'll be sharing some more good news with the staff as we progress. So we should have a clinic in by the end of the year.
Say, Jim, do you know what they're building next to the bank right now?
A solar field.
Oh.
That'll power the bank.
South of the bank there.
The things on sticks, the posts.
It looks like a foundation.
Oh. It's not us.
Yeah, that's what I thought. I was kind of surprised.
Surprise.
Maybe they're doing some type of shed or something with the bank. But
Yeah.
all the sticks and the things is a solar field.
Mm-hmm.
And maybe so it's a generation thing or something to go with that.
But yeah, no, our lot will be north of the bank there. So.
And we're publicly announcing the opening of the building of the clinic in our community newsletter that will come out around the 15th of April. So that will be kind of our big public announcement. And we were hoping to do a groundbreaking type thing, but it'll just have a picture of with it.
So, any questions on Janesville? Like I said, working on it. We'll have hopefully more good news and some more formalized plans, and as those come to life, we'll be sharing them with everybody. Okay, cool. Strategic planning, I know that's something that some of the people around this table have been a part of. Beth, I think you were a part of some strategic planning session. We did have an employee session yesterday morning. Thank you. And we have another one set up. We have another one set up next week that please encourage people to attend. But we have the general framework set up with our objectives and strategies, and we're really looking for help from everybody to try to fill in. What are the tactics to really accomplish our different strategies and objectives? And I know that we've kind of gone through that once, but thought that now that we have some formalized thoughts, that we have a framework on paper, that it's good to revisit that and make sure that we're listening to everybody and trying to incorporate everybody's thoughts into this plan. So please try to attend next week. Like I said, would love to hear from everybody. We are going to be hitting the ELP. We're going to be hitting the managers at the ELP 1, and then the manager sessions, and then having another session with the physicians as well. Okay, so plenty of opportunity for everybody to get involved and to see the draft and to see where we're going. So, any questions on that process and where we are with the strategic plan? The idea is to have it wrapped up, and so we can start working on it at the start of our new year on July 1. Okay? Cool. Finances have continued to look strong throughout the entire year. Again, I think that just the revenues staying where they are, but us being conscientious of our expenses has really made this a strong year for us financially. And so just appreciate everybody's efforts, appreciate everybody being cost conscious as they've been working through this year, and it's really been benefiting the entire organization. More fun news on the finance. You'll see that we're kicking off the budget season, and so information is already coming out. And again, I'm just going to ask you to just be cognizant and just understand how important your department and your input onto your departmental budgets is as we're moving forward, because it really does have a ripple effect through the entire hospital. So continue to work, continue to look for areas to be efficient, and look for those opportunities, because now's the time to really start planning the financial piece for next year as well. So, any questions on budget? Is everybody super excited for budget? Is anybody like me that does get excited for that stuff? So, the last thing that I wanted to just talk to you guys all about was I attended a conference a couple weeks ago, and one of the things that they did at the conference was the American Hospital Association gave their legislative update, and just wanted to let you know a couple of things that were out there. I think the overarching thing is continued critical access. And the legislation behind critical access, is always being looked at. It's still seen as low-hanging fruit. Wasn't a major focus, but before I got into what their focus was, I did want to mention that. And so just continuing to keep our finger on the pulse of where critical access is going and what it's ultimately going to look like. But one of the things, and this is to kind of piggyback on the budgeting, is there was some genuine concern over the federal budget. Over the next year, and ultimately how that will impact funding for healthcare moving forward. And so there's some key dates and there's some key times that are going to be really looked at. Actually, one was today. It seems like everything was okay. Our doors were open, but come this fall, looking at a few programs that are expiring or running out, and ultimately what the government will do with that is going to impact how much money there is in the budget in Medicare, and how much our doctors are going to get paid, and how much we're going to get reimbursed. Okay, so to piggyback on the budgeting thing, that general concern really makes the need for us to stay as efficient as possible, look for those areas to try to find some savings during this budget process. I know that the same tune has been sung for years and years in healthcare, and that reimbursement's going down, and we're asked to be doing more with less. I really feel some of that, not to scare everybody in here, but I feel some of that this year, and so it's gonna take all of us to remain at that level of financial stability, and ultimately that helps us with all the other things that we're undertaking. Okay, so. Trying to create that burning platform for staying nice and efficient and cutting some costs, okay? So cool. Those are the big happenings in my world, looking at a couple of different programs to get off the ground. Nothing really cooked there yet that we are looking to share. But we'd like to just open it up for comments and questions and just address whatever's on your mind. Yes, John. Something? Yeah.
No. I'm excited for the budget as well. We got a lot of projects in IT, and
yeah.
I'm just enjoying that you embrace IT as a necessity.
Yep. So here's can I get my little IT message real quick? Just to be nice to our IT guys. Unfortunately, IT is that one area that we don't think about until something's not working. But nobody ever thanks them for when the computers are running smoothly, or that our systems are up and running, and we don't and they function as they're supposed to. So thanks, IT, and we appreciate you. So.
Question
What
about
else?
Janesville.
Yes, ma'am.
Is that going to be employed with a physician or a double?
Yeah, so right now we're looking at it. We have had some requests from our providers. Actually, quite a few are interested in going down there, provider and staff. Right now we're looking at a mid-level. We do have a few that are interested in going and staffing that clinic. Diane's working to try to put together the ideal schedule. But we have it narrowed down to a couple, and hopefully we'll be able to announce that here shortly as well. In the beginning stages, it's gonna look very similar to Nashua, as Nashua did when there was the one provider up there. We feel that there's some pretty significant opportunity. The interesting thing has been Janesville embracing the clinic already, and people just coming out and saying, we're excited, we're glad that there's going to be this clinic down here. We appreciate the investment in this community, and so we know that it's going to take time to ramp up. We know that it's going to take time to get busy, but really think that it's going to be a good opportunity for Janesville and a good opportunity for us. So
So you're gonna start with one provider?
start with one provider. The clinic will be outfitted to handle two. So like Nashua, just anticipate the day where we will have an extra provider in there.
How many exam rooms?
I think we don't have final plans. And in fact, that was one of the things that we were reaching out to see if we could start working on that. The company that we're working with has built some of the clinics in the area. They've worked with Allen, and the model, if anybody's interested, is drawing a blank on what's the name of the town? Olwine. I'm thinking Oskaloosa with my head. Olwine. The Olwine Unity Point Clinic is actually very similar to the layout that we're going to be looking at here, but would anticipate three per provider, so 6 total exams.
I think ideally Diane would like a procedure room too,
Mhm.
which is something we don't have in Nashville.
Right.
So. But it will be square footage wise very close to the Nashville one.
Yeah, looking at about 3,500 square foot.
Different layout.
Yep.
So as like Nashville Taylor Therapy goes up in price, will there be?
It'll be just the clinic, yeah. Yep. What else? Questions, comments, concerns? Okay, you guys are hurting. Because last time we had Q&A for a solid 25, 30 minutes. I was kind of hoping that we'd have some of the same.
Are we foreseeing some craziness when the Mumford and Sons concert rolls into town?
Now, what's that? Yeah. They anticipate, yes. Volunteer-based, from the hospital standpoint, volunteer-based first aid station down at the concert itself, where we'll be able to handle kind of nicks and cuts and overheating, Tylenol, that sort of thing, just kind of Band-Aid station more or less. Yes, we are looking at staffing the ED. We feel that that's where the major influx is going to be, and that's what the history of this program or this concert has shown us, is that the ED is where it gets a little busy. Working on making sure that we have adequate ED staffing. Heidi's done a good job of making sure that we have our emergency preparedness model up and running, so that we actually have that system of communication and responsibility set up for the concert. But yeah, pretty significant. They're going to block off. It sounds like they're going to block off down a big chunk of downtown. 35,000 campers. Well, not necessarily all campers, but 35,000 people. It's a pretty big influx of people for a 2-day concert. So.
And we're going to work really hard to keep Jim's on.
I'm excited. So.
Are a majority of the clinics going to be closed that Friday? Do you know what the feeling is? Because I know that we talked in our clinic and we haven't come up with a decision. We haven't talked about it in a meeting yet, but for patients to try and get here might be a little bit difficult.
That's interesting.
We have a planning team that meets for the first time, I think, next week, and that's on the list.
Okay.
Really what we're doing is we're dusting off our reg guide plans.
Okay.
And so all those questions we'll start talking about. Diane is definitely on the committee, and we'll bring Lisa in as needed to talk about those things.
Perfect.
So we'll talk about security, we'll talk about access to the facility, communication about road closures, all of that type of stuff. So, yeah, they really anticipate starting Thursday night. I believe the campground's open at noon on Thursday. Thursday evening they start downtown activities, and then Friday at 5 is when the main stage opens for the first time. So there'll be a wide variety of when people are coming to town. Currently they're at 8,300 for ticket sales. So ticket sales are pretty lower than we anticipated at this time. But there's still a lot of variables that we're still shooting for 3,500 or 35,000. It could be closer to 20,000. So, but yeah, it's definitely on our list to make those decisions.
Luckily Jim Schutte from our ambulance is pretty well connected as well. So Heidi's extremely well connected down with the city and everything. So we feel like we're ahead of the game, but still a major undertaking.
When is that? It's June 18th, 19th, and 20th.
Just have a comment. I don't know
we've just heard, I don't know if the clinics are hearing it, but with some of our patients, just noticing the orange lot being full at times. For example, Monday, I don't know if there was anything extra, but our patients came in about 10 o'clock and they were like, there were 2 spots left in the orange lot, including doctors, parking.
Mhm.
So I don't know if that's something that can be looked at. And the other challenge, Heidi, I don't know if you've heard it with the Cedar Valley Clinic and the cardiology being held.
Dr. Sundrum?
Dr. Sundrum's office being held, their clinic, that a lot of patients are challenged with signage. And I don't know if it's their responsibility or our responsibility, but they end up coming all the way down or they get brought to
Sure.
our clinic, which we're happy to escort them back. But they come in that door and they see women's clinic. And so I don't know, just
Right.
a comment with signage maybe to look at for.
Yeah, we have recently supplied all of our visiting specialists with
Okay.
new maps specifically to get them and their patients there. So we're working on them
Yeah.
helping their patients with communication.
Exactly.
We've also
Yeah,
developed
probably
maps because Sunderland used to be at cardiovascular. So
Yeah.
we've given cardiovascular maps to help them
Okay.
because they can't leave their department too. But
Yeah.
yeah, we'll take a
They
look
just
at that.
see that hallway, they see the sign women's clinic and they think, well, it's not down there. They don't
Right.
realize there's another office area.
Yeah,
Okay. Thank
maybe
you.
another sign, because they have the urgent care clinic sign there, right in the doorway as you walk in, maybe we could just have another sign.
Yeah, I don't know, I just know it's been, since they kind of relocated,
Mm-hmm.
patients.
And has it only been his clinic?
Yes,
That-
that we've had.
We can look at maybe adding.
And they probably bring this to
specialists.
us because the cardiac and.
And there's
all that.
2 of them going on at the same day, which is very confusing.
Yeah,
I think the wall sign there says visiting specialist.
yes,
clinic,
and
that
that's
one.
all, but it doesn't say his name, so that doesn't click to them visiting
We
specialist.
Sure.
just ran out of time there.
Yeah.
Yeah, committee meeting.
Yeah.
So, but yeah, we'll take a look.
Perfect, thank you. What else?
Is it, this is just something else
Yeah,
missing from
please.
comments of staff coming in. With the walk-in clinic being there, I know a lot of people are lining up, and I saw Greg
Sure.
this morning with the number thing, and they're trying to resolve that. Is it some sort of policy that they can't wait in the waiting room? The clinic's gotta be close so long? Okay.
Yes, and
Okay.
so it's a, quite frankly, it's a silly rule and it's a silly hoop that we have to jump through. But we have to distinguish the walk-in clinic from the Christoffel clinic. And that forces a bunch of people to have to sit out in the
Yeah,
hallway
they're out
and
in the
wait.
hallway.
Exactly. And it's not right for our patients, it's not right for our staff, it's not right for the, I mean, it's just, it's the hoop that we have to jump through in order to have that, unfortunately. So, trying to figure out different ways to make that work. Yeah, the number system, will hopefully that way people don't have to just sit there for 2 hours in line,
Yeah,
but,
anyway.
Yeah, so what we tried to do is we added the little waiting room,
Yeah.
and now that we have the numbering system, it's just going into effect. People can grab a number, take a seat, and they'll not lose their place in line. We're not able to put chairs along the hallway because it's a fire escape route and stuff. But, yeah, we've been trying to find solutions to
Yeah.
that.
Can't adjust hours at all somehow prior to that?
We have to be closed
For-
for physical
Gotcha.
time, and that's, they come a half hour, an hour early too.
Trying to get in line to be first in line.
Exactly.
Yeah.
But now that we have the number, at least the people who aren't feeling well, they can sit down and they don't lose their place in line, because nobody wanted to leave the hallway.
Yeah, they want to keep their place in line.
yeah,
No, I don't.
yeah.
That
and,
helps explain.
Yeah, unfortunately, until there is, and I'm not announcing anything, but until there's, a new facility, a new building, a new wing or something, we're kind of going to be stuck with the physical location. We just need to figure out the best way to work through it.
And the 3 hours the walk-in clinic is open, they can see as many patients in that time as a clinic can see in a day. I mean, they'll
Mhm.
register 30 patients in the first hour. I mean, it's amazing.
Yeah.
The people coming through.
Yep.
When does the new marketing campaign begin?
The Amperage project, it's actually, I just met with them last week. And so the first step of the project, they're going to be doing personal interviews. And so we're just in the process of getting that started. So it'll probably be about a 90-day process. And so about the time the fiscal year is starting, we'll have some new potential. And for a lot of people, I don't even know, did we talk about this in the management team notes or anything? Anybody know what I'm talking about?
Yeah.
A little bit, okay. Okay, we engaged with a company called Amperage, which used to be formerly Me and V Advertising out of Cedar Falls. People are probably most familiar with that. It's been 10 years, 11 years since we became Waverly Health Center. And we really haven't done much with our brand and with our image since that point. So we engaged with them to just help us take a look at it, help us make sure we know who and what we are, and that we're communicating that well. So we're going to just start kicking that project off here, and they will hopefully give us a little bit of a fresh view, fresh look, and make sure that we're on the right track. So
Along with that, will there potentially be a name change?
that's not in the plans.
Okay.
No,
Let's hope
we're not.
Amen.
We went through a name change in Humboldt, and just the cost associated with change. When you start thinking about where our name is, I mean, our name's on everything.
Yeah, we did that.
Oh, did you?
Yeah,
Yes.
I see here. I still find it once in a while.
Yes,
So-
it still pops up.
Visible sometimes.
Yes.
It was still our official name too.
Oh,
Yes,
yeah.
it would
Doing
have that.
business.
Yeah.
Yeah.
But we are not planning on changing our logo even, really. There could be some minor tweaks to it. Maybe, I think they call it a bug, is what they were calling it, but something to maybe go along with it, maybe a color change, because officially our color is still the burgundy, which is really, in 2004, it was the color that everybody had, and you just don't see it anymore. It's kind of past its time, but that's really to be determined at this point. So I'm trying to let the process go.
It'll lead us to the answer, yeah. But it's gonna be a fun process too. Have some pretty great ideas. I think it's exciting. So,
When are we supposed to hear on the Plain Tree designation?
yeah, I'm sorry, I meant to mention that. We have our site visit at the end of the month here.
April 21st through the
Yep.
23rd.
Yep, so they'll be here,
21st through the 23rd, they'll be on site.
and so, yeah, they'll be on site and we'll be going through that process. It's my first time really talking with the Plain Tree folks, and so it'll be a learning experience for me. Thankfully, there's enough tenured individuals here to kind of help me through that.
Lisa Forsythe's putting together an email that she'll send out to all staff here in the next day or two.
I have one question for you. On the 23rd, we have an all-day booked in 10 girls for a staff training. I don't know if they'll need that for the site visit.
We're using CG room.
Okay.
We're using Kendall's the first day and CG room the next 2
Okay.
days.
Cool. What else?
I sent an email about road construction. So the positive is when you pull out of the parking lots, you won't bottom out anymore. So think of the future of what this will be. We'll have a little bit of pain during the summer, but the city recognizes the challenges for us, so they're doing all they can.
Do they
to make
anticipate
sure.
that construction being done by the music festival or not?
They actually are getting an earlier start than anticipated, and if the weather holds, we should be in good shape. If nothing else, they will pause the construction and make sure that our 10th Street entrance to the hospital is open for us. So our biggest thing will be there could potentially be a 2-week time period where that entrance is relocated slightly to the west. So, do that. So just, anyone, Linda, all of your deliveries, anyone coming from the north side, making sure that they know about it. And just kind of go with the flow for a while. It'll be a good thing when it's done, and 20 years from now, they'll look at doing it again. So we got some time in there. There's going to actually be a ton of road construction in Waverly over the summer. Everything else going on, lots of different streets here and there closed. So 4th Street itself that's 4th Street. The main 218, they're doing the 3 lanes, so the 2 outside and then the suicide lane in the middle. So it's just road construction everywhere. So.
Hopefully we decided to do the Green Bridge, so we have another access point for Bremer and stuff.
Yeah, that was the one thing. There was nothing definitive on that yet, on what they're going to do. But
They have hired a consultant.
yeah, recognize the need for some sort of another crossing. So we'll see where it goes.
I guess last random thing I was wondering on, the fire hallway from that joint commission, there
Yeah.
more news on that?
I don't know that we've actually done anything about that yet.
Fire the stairwell.
The
maybe?
stairwell.
Yeah, if the music and everything's gonna go away.
Yes. Well, the music, I don't know about that, but we are gonna be moving the, like the tree, that type of stuff. We're putting them in different places throughout the hallways. And we're going to put a little plaque next to them that explains where they came from, for the retreats and stuff. I'm not sure what's been decided on the blackboards. I think they possibly would just go.
I think they're looking to be able to hopefully use the stained glass window stairway, possibly as, that's what we
Okay.
talked about
What
last
happened?
week.
I got some.
We were told
Sorry,
that
not to-
it's a fire exit, and we can't have any of that fun stuff in the fire exit. Is the long and the short of it.
So
Yeah.
we might modify them.
Yeah, the Joint Commission consultant, he opened it and said, bingo, jackpot.
Yeah.
So it'll be a fun
Unfortunately,
meeting.
I know, ruining our fun. But
He did say there was plenty of other stairways that we could do that
But
stuff.
that's the only,
That's the only one that's
Forced.
opened out.
yeah.
And that's the biggest hazard. That's what he said on the recording, we can limit any other one that's not like designated that way, so.
Fun here.
yeah. So. Anything else? Wrap it up. Get ready for next meeting. All right.